love to learn more about your eye health, welcome to the Community Eye Network. I'm Mercy, a community eye health educator and ophthalmic clinic officer. In today's live stream, I'll be talking about working with the community to improve their eye health. If you're a health worker, you may be well conversant with the several interventions that have been put in place so as to improve the eye health of the community. But if you don't know, don't worry because I'm going to discuss about those interventions as well. So before I go ahead, kindly subscribe to my channel and let's continue with this discussion. Now, there are already interventions in place that are contributing towards improving community eye health. And these interventions involve encouraging community members to take better care of their eyes. And intervention number two is increasing the number of community members that are turning up for utilization of the available eye services. These are the two major interventions that have been put in place. If you look at it universally in most countries, these are the two major interventions that are in place. But let's go a little bit deeper in those interventions. The first intervention is encouraging community members to take better care of their eyes. And this is being done through um, behavior change programs, such as encouraging community members to wash their face and also to wash their hands. And then the other is to improve infant feeding practices. These are the major two practices that are being done in the communities through health educating parents on balanced diet for the children, especially diet that is full of vitamin A, so as to prevent blindness. And then the other intervention, number two, is increasing the number of people who are actually utilizing the available services. And this is being done by encouraging older people to come for cataract surgeries and also conducting community eye outreaches and administering mass drug administrations. So those are the major things that are working in communities. But when we look at in depth the impact of these services, it is not really impacting the communities as much. So that's why I'm concerned a bit, and I want us to discuss this topic a little bit deeper. Why are these interventions not working out despite when you look at them, there are really very good interventions in terms of improving the eye health of the community. So there must be something that needs to be unveiled about our communities down there, especially communities in developing countries. We have a lot of barriers and obstacles towards eye care. So I want us to look at that briefly. Now, when you are looking at improving the eye health of the community, the only way you can improve eye health in the community is by partnering with the community itself. Because an intervention that might have been successful in another community might easily fail in another. Why? Because communities are different. Yeah, they have different beliefs and traditions that may be affecting their a willingness to change their habits and behavior. And also, there are barriers that are specific to communities, and these barriers could be hindering or limiting the uptake of eye services. So now, having known this, what should we do now? What is the way forward? The first thing that I think that we should do first of all is to understand the community. It is very important to understand the community because different communities have different beliefs and they have different traditions. And these play a very big role in implementing the eye interventions that have the interventions that have already been put in place so as to improve eye health in the community. Let's look at the intervention that involves encouraging people to take better care of their eyes. And this intervention, the programs under these interventions are basically looking at behavior change, where we see people washing their faces more, washing their hands more, practicing good feeding practices for the infants. Now, these services of washing, when you look at hand washing, in most of these rural communities, hand washing is a taboo. People are not doing the hand washing. So we have to go deeper and understand, why are these people not doing hand washing? Could it be maybe they don't have water? Maybe there are no water, there's no enough water in that community. Could it be that they have certain beliefs that encourage them not to do the hand washing? It needs us to go a little bit deeper and dig out, why are they not washing? Sometimes it could be that these people don't have knowledge, they don't have the information. So you go ahead and give them the information, why they should wash the hands, why they should wash the faces. So it could be as simple as that, because when you bring up an intervention and you tell people you need to have hand washing facilities in your homes, in your schools, but why? They will always ask the why. Maybe they have little knowledge, because when you look at our communities, hands are washed when somebody is going to eat. Hands are washed when somebody has finished to eat, or maybe when somebody has been doing work that has dirtied their hands. That is the behavior in our communities. If somebody has not touched maybe something dirty like mud, like that has made the hands physically dirty, that they can see the hands are dirty, the person may not see the need of hand washing. They may not see the need of face washing, because when I washed my face in the morning, I know it's clean and the whole day it is okay. For them, the community may be knowing face is washed only in the morning when you wake up. So to come up with a working intervention, we need to go deeper and understand the beliefs and the traditions in that community. In some communities, you may find that there is a risk behavior that the whole community is doing. For example, poor feeding practices. It could be that in a certain community, they wean children and they are given a certain diet that may not provide the required nutritional needs of a child. So you need to go deeper. Maybe that's a diet that this community has grown, knowing that this is how we should feed our children. Yeah, they have copied this from generation to generation. So you may not easily just wake up from the blue and you tell such a community that this is the new type of food that you should give your children. It is going to be difficult. These people may not accept it easily, even if they are seeing that their children are not doing well. they will know maybe it's their ancestors who are making their children be that way, because that is also a behavior in most of our communities. Yeah, we associate, the community may be associating their eye problems or their conditions to ancestral beliefs. So we look at a community as a whole. If there is a risk behavior that is threatening our vision, it should be approached according to a specific community, and a solution should be good for that specific community. You do not expect to carry that solution from that community to another community with a hope that it's going to work. It may never work. So the other thing could be a risk behavior that is considered socially unacceptable, and this may be an individual risk procedure. For example, take for instance, risk behavior that may uh, cause a risk to vision loss, maybe because of the hazardous kind of work that somebody is doing. Maybe he's working in an industry, maybe, for example, in rural setting, we have a lot of people who are doing welding work. Yeah, welding. They are dealing with metals, burning metals, connecting them, making doors, making windows. I have this particular experience that I want to share. In my static clinic, there's this patient that I always received maybe once or twice in a month with a corneal foreign body. So this patient was working as a welder, but he could not wear protective eyeglasses when he's doing the welding work. And he did not know the importance of these glasses. So he's somebody who has grown up not using them, and on top of that, he has no knowledge on the importance of wearing those protective glasses. So the first time I saw him, I took the history, I got to know the kind of work he does, and I explained to him the need for him to wear the protective glasses. And when he went back, he continued not to wear them. The following week, this patient is again back with a corneal foreign body on the eye. So I was wondering what is wrong. Yeah, that is what I just want to bring out a point about uh, considering involving an individual or the community to understand to the depth the problem, why is this individual behaving in a certain way. So this client of mine simply needed information, and when he got the information, I'm so happy. Several months later, he saw the importance of wearing the glasses, because I had to explain to him that when you continue with this kind of behavior, you're going to have a lot of corneal scars on your eyes. And with the time, your vision will be compromised. Who knows, maybe sometime you'll be having a more bigger uh, problem, yeah, a more bigger corneal foreign body on your eye than even this. And these are metallic FBs. These are metallic foreign bodies. Anything can happen to you. It may spark out a uveitis. It may go beyond being just on top of the cornea, and you get a more sharper metallic particle that can penetrate your eye to the deeper layers. So yeah, I had to explain this to the client, because he was not really understanding the impact or what this could lead. So after getting that kind of information, I saw my client change, and the behavior changed. He became more responsible about his vision. So it is very important to understand these underlying issues before trying to make any changes, and also work together with the community to challenge these risk behaviors and promote good eye health behaviors. Yeah, once we challenge the risk behavior, we should also be able to give them the proper healthy eye behaviors that can promote eye health. We should not only challenge the risk behaviors and leave out the proper ones. If you're telling me not to do this, you should explain to me what I should do then. Okay. So the other way forward to this is involving the community in planning, actually in planning of interventions and services that suit their needs. When we understand the community, we need now to involve them in planning and identifying the interventions that they feel is going to solve their problems. So we don't need to identify and then plan for them. Let the community be involved in the planning process. I think that is one of the reasons why actually these interventions that are already in place are not working out in some communities. It's because the community is not involved. You may not need to carry everybody in the community, but pick out community resource persons. It could be the LOC one, the village health team members, the church leaders. Yeah, these are people who understand better about their community. And in my community, I feel it very important to involve even the witch doctors as well, those sorcerers, because these are the first contact people of the community members when they have eye problems. So if we isolate them in these community eye health meetings, we may miss out because the communities actually find it very easy to believe in these people who have grown with them with their traditions than to believe you, an outsider who has walked in with a new propaganda, with a new, for lack of a better word, than believing in you, who has walked in with a new style of working upon things in their community. So when you involve this previously person that they trusted and even believed that is working wonders towards improving their eye health, it becomes much more better for them to assimilate, to accept the interventions that you're bringing in place. And actually, this could work. Now, another way forward on this is to understand the potential barriers to the uptake of eye services in the community. These also vary from community to community. Every community has its own barriers depending on uh, the circumstances that they are going through. So when we understand the barriers that are hindering uptake of eye services in a certain community, we shall also be able to acquire different solutions depending on those circumstances and available resources in that particular community. So this should be done also still in partnership with the local community itself. It should never be done in isolation. When we are offering community eye services, it's a bit very different from static clinical eye services, because these ones you're working on a patient who has come to you, is already believing that you are the one who is having a solution to their problem. But community interventions are totally different. These ones, you're entrusting the community to improve on their eye health. So they are the major player here, because you're not going to participate. Yeah, you're not going to actively participate in the hand washing. You will not be the one participating in feeding the children the right food. You're not the one who is going to be participating in face washing. it is the community member who is going to be doing that. So if you want to have this person do that, you must involve them from the start, because they are managers of their own life. It is not you, the health worker, who is managing. You're only supporting them, you're morale boosting them, you're giving them the information. Let's look at it that way. You're giving them the information, you're morale boosting them because you're watching them at a distance. And because of the health knowledge that you have realized that this could be the cause of this problem that this person is having. So how do I help? You're just like a referee. You're seeing what the players are doing, and you simply need to give guidance that this is what you're supposed to do. Mm? But the whole work is supposed to be done by the other person who is actually in the field playing the ball. So if we want to improve eye health in the community, which in essence is a role of every person who is passionate about eye health or health in general. So we have to involve these people. We have to involve them, and when we are involving them, we should be willing to go down to their level and understand why they are behaving a certain way, because most of the interventions are actually geared towards behavior change. Once people change their behavior and start assimilating and doing things that are right, that promote eye health, they will actually improve the eye health. We shall have reduced um, eye infections, because most of the diseases in developing countries are basically infections. So if behavior change is taken up by the community and they start doing these behaviors that promote eye health, we shall have a better um, eye health system in the communities. We shall have better uptake of these eye services that we have in hospitals. Maybe let me touch this a little bit. In Uganda, that is my country, um, when we look at the eye health system, basically the first primary eye health worker you will get at the hospital level. The hospital level is located at a district level. So in the sub-county level, in the parish level, until down the village level, we don't have primary eye health workers. So what we are actually depending upon is the village health teams. We give them information on how to identify these clients with eye problems and then refer them to the general hospitals where they can be seen. But looking at the different communities in Uganda, there is one thing that is very peculiar, and that is the high levels of poverty. So most of these clients cannot afford to transport themselves to reach to hospital levels, yeah, to reach to the district hospitals, because mostly the distances are very far. So they stop at the community level and they may never show up in the hospital. So when we look at that, it means we have to give time and understand the problems in the different communities and find solutions to those problems. So let me just run you through the barriers, because we want to understand the barriers to eye health. I want this live to last about 45 minutes, because I have a schedule to run somewhere very fast. So I'm trying my best. So let me take you through the barriers. I'm just going to brainstorm them. And then in the next live stream, we may be able to go deeper into these barriers. Um, in this journey of improving community eye health. So, barrier number one is poor marketing of eye care services, including poor information about treatment costs, and patients will need to know always this related costs. Eye care services are very expensive, especially when it comes to tertiary level. Um, let's look at this way. When we look at marketing of eye care services, in most of our government hospitals, we do have services there, but sometimes we have stock outs. So even when we market these services, that we have these services in a regional hospital, in a district hospital, sometimes when these patients come, they come with expectations. They know they will get their drugs there, they know they will get surgical interventions there, and then when they reach the facility, they find out that the drugs prescribed to them are to be bought, or maybe even sometimes they go back without these drugs because already they have no money. So that is affecting so much. That's another barrier to improving eye health services. Sometimes maybe you've conducted an outreach, or you have a camp, a surgical camp in a certain facility, but down in the community, these patients don't know about the cost of transport. You've not told them how much transport they are going to spend to reach where you are. You've not told them the issues to do with accommodation. Are they going to pay for the accommodation? Are you offering the accommodation free? So sometimes these people, they will hear the information that we have this eye service that is going on in this place, but because they don't have adequate information about it, they may ignore and may remain in the community and may not come, because they will ask themselves, how will I reach there? They will ask themselves, how will I sleep when I'm there? What am I gonna eat? So they will disappear. Now, when you are marketing eye care services, you should be very clear, especially people who are partnering to improve eye care services. If you're offering a free service, it's better be open to the community and tell them, we are giving you free surgery, but maybe you're going to buy your own drugs, you're going to find where you're going to sleep on your own, you're going to transport yourself to and fro, so that these patients are very aware. But when we go to the public and we announce, we advertise, we have free services, everything is free, without specifying what is free, it becomes a barrier at the end of it. And then the other barrier is insufficient counseling of patients. Sometimes we give these patients interface with the clinical workers or the doctors, but because you have not given complete information about treatment of these patients, or about the causes of their problem, sometimes this hinders the uptake, because a patient will always want to know, yes, well, I have a cataract. What could have caused it? Go ahead, have time with this patient, explain how the cataract the possible ways the cataract may come about. You may not tell patient, this is what has caused your cataract. No, tell the patient the possible ways that they can get a cataract, what are the risks, what are the causes of the cataract, and what is the available treatment for a cataract. Sometimes patients can come in a clinic and you identify that they have a cataract, but when you tell them the surgical intervention, they will always ask you, don't you have an eye drop that I can use to clear this cataract? And if you don't have the time to give this patient adequate about cataract, what it is, what causes it, the treatment for cataract, you are giving a gap to this maybe herbalist in the village who gives this patient information false information in most times about cataract, gives them a lot of promises that are actually not true, that this cataract is going to be cleared by this herbal medicine. You will see again, the vision will be clear, and by the time you realize it, this same patient is coming back to you with maybe a corneal ulcer, has got complications, and is ending up with a complicated cataract. So giving information is very important, because if you give insufficient counseling and to the patients, most likely they are not going to take up the service. And then the other thing is traditional beliefs and stigma is another barrier to the uptake of eye care services. Another one is decision making in the households. Yeah, most of these patients with eye problems, they are under the care of households. They are living in families. So if you're making a decision to maybe undergo surgery, your family members should know, and they should be willing to support you. If that decision is not taken positively by the family members, this may hinder, because the patient may be willing, the family members say no, this and the other. So at the end of the day, the patient will not be able to come and get that service. I have seen this during most of our community work, especially with the children who cannot take decisions on their own, and also the elderly, those patients that need to be given extra care. So the people always taking care of them do not support these people to go for certain treatments. So that is also another barrier to uptake of eye health services. Another barrier is social barriers, stigma against certain ethnic minority groups, like people with disabilities, people living with HIV. Yeah, these groups may discourage services for fear of abuse and unacceptance by healthcare staff and other eye health users. So sometimes in our communities, we also have health workers, yeah, who may stigmatize these people living with HIV. They fear maybe to do surgeries on them because they're already living with the virus. And sometimes people with disability, they may say, this one has a disability, we can live. But also these people with these problems, also they suffer from eye problems. So they need to get eye services like any other person, any other normal person who is walking well without any disability. So a disabled person, sometimes we have these people who are disabled, they cannot stretch out their limbs or their legs to lie on the operation bed. So you may find the health worker looks at it and ignores and says, this patient cannot lie on the bed for surgery. So maybe they may ignore and say, I cannot take care of this, I cannot do that on this patient. So this is also hindering the uptake of eye health services. Another thing is not seeing the need. Some people may not see the need for sight restoration or improvement. Mm, there are people they may not see the need for restoring their sight and improving their sight, especially people who are maybe people who are not contributing, for lack of a better word. But let me give this example. Maybe you have this very, very old man or lady in the house who is not doing any other productive work, maybe just wakes up and sits there. Sometimes the people taking care of them and also they themselves may say, I'm already very old. I don't see the need for me to restore my sight again. I don't have anything that I'm going to use it for. I just need to sit here, give me food, I eat, and it ends there. So that also is affecting. Sometimes maybe because the problem they have does not pain them, and they feel I don't see the need to go and operate my eye since it's not paining, it is not affecting me in any way. So let it be there like that. So also another barrier is con- convenience and competing priorities. Convenience and competing priorities is another barrier. Families maybe with limited time or finances may feel that it is easier to visit a local and potentially less costly traditional healer than traveling for clinical services. I told you earlier, most of these hospitals where you find these clinical eye services, they are located in urban areas. They are far away from rural communities. So when these families that have limited resources look at the expense of moving to find these clinical services, and then also looking at the cost, they may really say it's better I see this herbalist who is just a step away from my door. I can get a service from here. So that one also affects the uptake of eye care services. And then another thing is inaccessibility. Service centers may not be physically accessible for people with mobility problems. Yeah. In most of our hospitals, though there are now some improvements, you find that the buildings that they make, they do not provide these labs for people with disabilities to walk through with their wheelchairs. So the offices are inaccessible. You may find the clinical office is located maybe up on a storage building where this person with disability may not easily access. So there are a lot of problems around that area as well, and this is hindering eye uptake of eye health services. One time I attended a training, a community training on inclusive eye health, and we had two venues. There was a venue for the VHTs and another venue for health workers, but within the same vicinity. So we had venues of VHTs and venues of health workers, and one venue, the hall was located up on the storage building. And since this was an inclusive eye health training, of course, we had people with disability with each group, but now the people who were in the group who are supposed to have the meeting at the storage building and they were disabled, they could not access the storage building. They had to remain down on the down floor as their colleagues went on the upper floor. So those are some of the disparities that you may find, and they are hindering uptake of eye health services. This could happen anywhere, in a hospital, in any setting. Yeah. And you find that these people are not able to access the service. Members of the community. If maybe somebody had a very bad experience at the hospital, or if someone has previously sought treatment from a service provider and then had a bad experience, this may prevent others from coming forward for the same service. So it is very important that we treat our patients with respect and we give them all the service that they need. If you're not able to provide a service, can you be good and kind to the patient? Don't be rough on the patients. Yeah, these are also human beings like you. Before you treat somebody the way you want to treat them, Just think, if it were you, would you appreciate that level? So when you're a health worker, when you're a community eye health worker, look at every patient at that level where they are. So I think I'm going to come to the end of this live now. It has been a beautiful, beautiful time together with you, my viewers. Thank you for supporting me. And if you've not yet subscribed to the channel, kindly do so. Click the subscription button to subscribe. Subscribing is free of charge. You don't pay any money to subscribe. And also feel free to give this video a like and share it with other people. Thank you so much. I wish you a lovely day. Goodbye.